Hey y'all, it's Dr. Lipin with Northside Plastic Surgery, and today we're going to talk a little bit about lip filler. So lip filler is done in my practice with hyaluronic acid based products only, and it is a great way to enhance an already beautifully shaped lip by adding a little bit of volume. And it's also a great way if you want to enhance the shapes of your lips, such as having a slightly more refined Cupid's bow. It's a great way to achieve that as well. When I meet you at your consultation, we'll go through your goals and what look you're trying to achieve, and from there we'll work together to map out a plan. My favorite product for lips is currently Restylane Kiss. It is approved to last up to 12 months. However, some people do metabolize it more quickly, and so for most of my patients I would say it lasts about 6 months to a year, sometimes a little bit longer. The lips are a really sensitive area. Of course, we use them to talk and to kiss and to eat and to taste things, and so we have a lot of nerve endings. So I would say that it is a more painful area to inject. However, we take plenty of time. We'll numb your lips either with topical or we can do a dental block. And I will also use ice to try and help prevent any bruising, but also it helps with numbing. There's also lidocaine in the lip filler itself. So with the Restylane Kiss, there's actual lidocaine inside. So that will last for 1 to 3 hours after the injection. You will see your results immediately. You will have some swelling immediately, and then you will have more swelling over the next 2 to 3 days. And by then the swelling starts to come down. And by 2 weeks at the absolute maximum, your lips will be totally healed and perfect. But usually it takes about 3 days for the swelling to go down. I do my absolute best not to cause any bruises, but the lips are incredibly vascular, so it is always possible to have a small bruise after lip filler. I do recommend stopping all NSAIDs such as Advil, Motrin, ibuprofen, and aspirin at least 2 weeks before lip filler injection. If you take vitamin E, I would also stop that for the same amount of time. Same thing with St. John's wort, ginseng, and turmeric. That just helps prevent bruising. So it's also important when you're scheduling your filler appointment, if you have anything really important coming up in the next, let's say 5 to 7 days, I would probably schedule my appointment with that in mind. Just in case you do have a bruise, it can take 5 to 7 days to resolve. So once again, lip filler is a great way to add some volume, enhance your shape, or correct the shape of your lips. It is done in the office. The whole procedure takes about 30 minutes from start to finish. You will be numbed, and there is numbing agent in the filler, and you'll have some swelling for about 3 to 5 days, potentially some bruising, although I do absolutely everything I can to minimize the risk of bruising, and it will last between 6 months and a year. And all of my patients love it, and no one leaves with any sort of duck lips.